Hello everyone. We have Mr. John, a 66-year-old man. He come to the emergency department with acute onset of severe pain chest and shortness of breath. Pain is in the right upper chest and is aggravated by deep breathing and coughing. He is a known case of hypertension and obstructive sleep apnea. He quit smoking 10 years back. BP normal, pulse is raised, respiratory rate is high, BMI is 30, very high, and you are getting normal vesicular breathing on auscultation, and there is S2 is accentuated, tachycardia is there, ECG, chest X-ray is unremarkable. Tachycardia in ECG, CT angiogram reveals chest, the embolus in the right pulmonary artery. Oh, it's a case of pulmonary embolism. Most likely origin of this embolus is, well, the answer to this question is femoral vein. And believe me, calf vein is the most common wrong answer. It's not calf vein, it's femoral vein. Why this so? Confusion is between calf vein and femoral. So before we discuss this, let's learn the anatomy of the venous system of the leg. Well, this is the knee joint. Below this is the distal part and above is the proximal veins. Here we have an anterior tibial vein and the posterior tibial vein. This is distal, and then after that we have popliteal vein, femoral, deep femoral, common femoral, and external iliac veins are there. They are the proximal veins. Okay. Well, in our question we had the option of femoral vein. So the finding of a thrombus in the right pulmonary artery, CT angiogram, is a diagnostic of pulmonary embolism. The diagnoses were already given in the investigation. Now, deep vein or the lower extremity are the most frequent source. But confusion is when we talk about deep veins, people think about calf veins. No, it's not calf vein. It is lower extremity thrombosis is divided into two categories. Okay. One is proximal, thigh, iliac, femoral, or popliteal, which I show you in the picture also. They are the source of more than 90% case of acute pulmonary embolism, probably due to large caliber and proximity to lungs. Distal calf, which are below the knee, they are less likely to embolize and more likely to spontaneous resolution. So option A, calf vein, is not the answer. Okay, it's only 10%. Well, we saw this pulmonary angiography is the best investigation to look for the filling defect. Okay, very nicely shown by the, now it is, you can see much better. Arrow is already there. Now I've got two questions for you. In a case of pulmonary embolism, what is the most common presenting feature of PE and what is the paradoxical embolism? Well, stop the video, write down the answer in your copy. Most common presenting feature is sudden onset of dyspnea. The most common presentation. Paradoxical embolism that we see classically in tetralogy of Fallot, a venous thrombus enters the aorta and can lead to systemic embolization. And this is known as paradoxical embolism that we see in tetralogy of Fallot. Well, let's look into other option, renal vein. Thrombi coming from renal vein are common with patients with nephrotic syndrome. And nephrotic syndrome is, and it may occur in as high as 10 to 30% cases of nephrotic syndrome. But again, I have a question for you. Stop the video. RVT is most common in which type of glomerulonephritis? Stop the video, write down the answer. The answer is membranous. glomerulonephritis. Well, option D, right atrium, are common in patients with intracardiac device like pacemaker. They are less likely to resolve spontaneously. Upper extremity veins is generally uncommon, only 1 to 4% cases. So they are very less likely to cause PE. Common risk factors are thrombotic state, indwelling catheter, or there may be anatomical obstruction like cervical rib or bony overgrowth over the clavicular fractures. But all these are extremely rare thing. So this is very, very unlikely. The golden line to remember, proximal deep leg are the most common source of symptomatic pulmonary embolism. Other less common include calf vein, renal vein, pelvic, upper extremity. They are all extremely rare causes. So by and large, you can say proximal deep vein. If you remember this much, good enough. Okay, only carry home message in the whole other discussion is proximal deep vein thrombus is the most common site of pulmonary embolism. Thank you very much.